Welcome, everyone. We'll get started in just a minute. We're going to give it a minute or two for folks to join us. So we appreciate you being here with us this afternoon. We will get started in just a few moments. Thank you again to everybody for joining us today. Appreciate you being here. We'll get started in just a minute. We're just giving folks a chance to jump in. Their presentation today will be followed by a Q&A. So if you have questions after the session, after the presentation, please hang on to those and you can throw those into the Q&A, or as the presentation is going along, you can throw those into the Q&A and we'll work on those after the presentation is complete. Dr. Sakate, I don't know if you can change the setting on your display so that we can only see one slide. Now we can see two slides.
Oh, okay. You see,
I think it's just the display setting.
is it better?
I think it click whatever you just click the opposite, and I think it'll probably do it.
Just the opposite? Okay.
Yeah, because right now we can still see the two slides. I think for the first time you had it set up, we can only see one.
You may need to stop your share and restart your share because
Yeah,
it may just be linked
I
to
think you're right.
monitor.
Yeah. I'll go to slideshow here. Is that better?
Yep, that did it. All right, perfect. All right, so without any further ado, we will go ahead and get started. Thank you again to everyone for joining us today. Welcome to the Student Open Forum on COVID-19 and vaccinations. My name is Paz Olivares. I'm your Vice President for Student Affairs. Thank you so much for joining us for this important opportunity to learn about the current status of COVID-19 in our communities and to share information about vaccination. To answer questions today is Dr. Michael Sakate, who serves as the Public Health Officer for San Bernardino County Department of Public Health. We're also joined by campus leaders who will participate in the question and answer portion of the program, along with Dr. Sakate, including our CSUSB President, Dr. Tomas Morales, for Academic Affairs and Provost, Dr. Sharon McMahon, our Vice President and Administration and, Vice President of Administration and Finance and Chief Financial Officer, Dr. Doug Freer, Vice President and Chief Information Officer, Dr. Sam Sudaker, Vice President for Advancement and Executive Director for the CSUSB Philanthropic Foundation, Robert Nava, Vice Provost for Academic Programs, Dr. Claire Weber, Associate Vice President of Student Affairs and Dean of Students, Dr. Derry Graham, Associate Vice President for Student Equity, Dr. Molly Springer, Interim Director of Risk Management, Lenise Warren, and our Student Health Center Medical Chief of Staff, Dr. Rochelle Maraschino. Before I turn it over to Dr. Cicada, I would like to share a few highlights of his distinguished career. Dr. Cicada received his medical doctorate from the University of California, San Diego School of Medicine and completed his residency in internal medicine and emergency medicine at the University of Oregon Health Sciences Center in Portland. For the past 30 years, Dr. Cicada has worked in leadership roles at the local, state, and national levels, including as regional director of 6 hospital emergency departments, including hospitals in San Bernardino, Apple Valley, Colton, and Redlands. As a dedicated medical professional in Inland Empire, he joined the San Bernardino County Department of Public Health in 2020. Please join me in welcoming Dr. Michael Cicada.
Thank you, Dr. Oliveris. It's been a pleasure to be here today with you, and I'm excited to actually present to you a little brief history of where we're at in what for many of you will be the first and hopefully the only pandemic through which you've lived. This is my second, and it was the AIDS pandemic the first time, and this had a significantly greater impact than AIDS. And what I want to do today is present some background on the impact of COVID, the development of the vaccine, where we are in our vaccine, and where we are in the endemic rate or the actual infectious rate of our county, and then hope to answer a lot of your questions about the disease and especially the vaccine, because this is the time we're all at the point where we can really execute the final dagger to this pandemic, and that's the vaccine. So a big point of this presentation will be the vaccine itself. We could have a whole nother lecture about the pathophysiology of COVID, and if you have those of you who have biologic or infectious disease interests, feel free to ask some questions as well, but I'm going to focus on that. So what I'd first like to do is start out with a story, and this story just impresses me about how powerful our science is. In somewhere in the middle of December of 2019, this new flu-like illness was discovered by the infectious disease and primary care doctors of Wuhan, China. It was probably around the 15th, 16th, and by December 31st, 2019, the World Health Organization made an announcement that there's a new mysterious pneumonia that's affected dozens of Chinese in Wuhan, China. The rapidity of this is amazing. By January 11th, so this is now 12 days later, China reported the first novel coronavirus death. Later that day, in the same publication, the Chinese scientist published the complete genome or DNA sequence of that virus. So on just 3 weeks after the disease was suspected, just 12 days after the first death was announced, they had released the complete genome, the entire DNA sequence of this virus. But in the same conference that the Chinese scientists published this DNA sequence, they released the sequence to the scientific literature. And the next day, there were 20 vaccine groups that were starting to work on this vaccine. The first two were the first two that came to fruition, Pfizer and Moderna. And interestingly, and laudatory is the collaboration. Pfizer and Moderna worked together. They shared their secrets and to to work towards getting this. And we knew we were in for something at that time. By February 10th, we had the first vaccine candidates that were designed and manufactured. And by March 16th, the first phase of trials of the Pfizer and then Moderna vaccines were begun. So you can see the amazing progress that this, it shows the power of what the world can do, and all the scientists of the world collaborate in approaching a very formidable disease like COVID. So, and this is what it's done to our county. This is in March, when they were just starting to work on the vaccine, March 1st. And you can see that we had a little bump in July, just after the summer months. And you can see that just around Thanksgiving, in the end of October, we started seeing a bump, and by and this is January, it was the peak of our incidence of COVID cases. We had hit that peak, and this virus, as you all are probably very much aware and have had to go through all of the distancing and basically hibernation that you've had to do, completely overwhelmed our country, our state in San Bernardino. I was basically supervising our hospitals, which were completely overrun. We had to have patients in our cafeterias, all of our patient lobbies, our gift shops, and three of our hospitals in San Bernardino County ran out of oxygen because of the amount of oxygen that we needed. And you can see very close to here in March is when we actually, March is more here, when we started to bring out the vaccine. And so a big part of this is development of the vaccine, and also basically the cumulative efforts of everyone working together, wearing masks, social distancing, et cetera. So we've had over 4,500 deaths so far, and they continue to occur, thankfully, much less frequently now. In fact, over the last week, we've only had one death, but we're still seeing them. So COVID has certainly hit us. The vaccine has actually, there's never been a mass vaccination effort like this actually in history. We've done a lot with smallpox, and it made a huge difference in the world, but we've really rolled out the vaccine and made terrific strides in getting as many people vaccinated as possible. So this is the number of, keep in mind, we have 2.1 million people in San Bernardino County. So the total doses given to San Bernardino residents allotted is so far 1.4 million, and Pfizer vaccinations 508,000, and Moderna vaccinations 450,000. And the Janssen was technically, that's the technical name of the Johnson & Johnson vaccine. So we've given out 53,000. In the U.S. alone, this is actually a day and a half old material. We've given over 212 million doses, and we're vaccinating people at 3.35 million per day. And in the world, I just checked this morning, it's actually 1.2 billion doses given. So if you can think about, and if you're, this is one of my first attempts at just assuring you of the safety. If you think about how many doses and how many people have received these vaccines, we have a huge idea of the tremendous efficacy and also the tremendous safety of this vaccine, of these three vaccines. And I'm going to talk about a few of the things that people might have some second thoughts on, like the Johnson. The first thing that when we first started rolling out the Moderna and the Pfizer vaccines, there were some reports of anaphylaxis or severe allergic reactions to it, and there was a significant concern. And we are recording. We have an app and a database for all vaccine reactions. So, and it's actually on an app that all our patients get. So we actually can track this better than probably any previous rollout of a vaccine. And so we've been able to treat, when we looked at this anaphylaxis, and we were about to pause Moderna because we thought there were a significant, there were I think there were 10 people within a week and a half period that actually got the anaphylactic reaction to the Moderna. It's like the anaphylaxis is a severe allergic reaction where you get not only the rash but swelling of your mouth, and you drop your blood pressure, and those of you who are allergic to bees, that's an anaphylactic reaction. So we've been able to track the incidence of anaphylaxis for the two major vaccines, and it's extremely low. Here's the incidence is for Pfizer is 5 cases per million doses, and for Moderna it's 2.8 per million doses. And just to give you a reference, for penicillin, if we were to go about vaccinating everyone with penicillin, the incidence of anaphylaxis is 320 cases per million. So that much more. And we certainly haven't stopped giving penicillin shots and prescribing penicillin for people who need it. So just to give you an idea. So, I mean, it's with regard to anaphylaxis, it's so safe. I mean, safer than obviously penicillin, safer than aspirin, and it's really not even a concern to us anymore. We still, in people who have a history of severe either anaphylaxis or severe allergic reactions to other shots, the one thing we've done in modifying our routine is we'll watch those people after their Pfizer or Moderna shot or Johnson & Johnson shots for an extra 15 minutes because anaphylaxis usually hits within 30 minutes. So very safe with regard to allergic reactions. I want to talk a little bit about the Janssen vaccine, the Johnson & Johnson. It's a little different, it's developed with the different mechanisms that the Pfizer and Moderna are what we call messenger RNA. I'm going to go back a little, and I didn't talk about that, but the Pfizer and Moderna are basically messenger RNA derived vaccines. And the way they do that is they take the DNA of the virus and they overlay and develop just a piece of messenger RNA, just enough that it tells the cell how to produce the S or spike protein of the virus. That's the spike protein. You've seen the pictures of the coronavirus. It's got these spikes. Those are the spike proteins. And it's just that the sequence of messenger RNA that tells the cell how to produce the S protein. So we encapsulate that in a liposome, and we inject it, and it goes into the muscle cells of the deltoid, and it basically enters the muscle cell, doesn't get into the nucleus, and just teaches the muscle cell to produce the spike protein. The messenger RNA lasts only about 36 hours, a day and a half, and it's gone. It's just that cell and the messenger RNA basically are destroyed by the antibodies and the T cells that are derived from the S protein, the body's reaction to that S protein that gets released. So that's a messenger RNA, and then you can easily see that it never gets in the nucleus. So you hear all these theories and concerns about it affecting your DNA, affecting your children. It's if you know genetics, if you know molecular biology, it's impossible to do that. So I go through that just to kind of assuage your fear of that the messenger RNA will somehow get into your DNA and affect your lineage. So not a concern. Now, let's get into the Johnson & Johnson. It's a little different mechanism. This is more of a traditional mechanism. It's they take an adenovirus, which is another type of cold virus. And this is actually an adenovirus that's been neutered, basically. It's what scientists call replication incompetent. They've actually taken out the part of the DNA that actually is responsible for replication and took it out. So it's replication incompetent. So it can't grow in the cells, but it can get into the cells. And so they've actually loaded on this spike protein instruction onto this adenovirus. It's like a Trojan horse. It goes in and it then incorporates into the cell and teaches it how to produce the messenger RNA and the spike protein. So from there, it gets the same. Once the spike protein is produced, the body develops an immune response to it, producing both B and T cell activation. The B cells are the lymphocytes that produce antibodies, and the T cells are the lymphocytes that actually have the memory for a reaction. So it's a little different. Every bit is safe, and the one thing that we liked about the Janssen vaccine is that it's a what we call a one and done. It's just a single a single shot, and so we introduced that a little later. It came out about a month after the Pfizer and Moderna. But what happened? We actually had to pause because we noticed there were 7. They were all women who actually developed this peculiar blood clot. It's called cerebral venous sinus thrombosis. We renamed it VIT, or vaccine induced thrombotic thrombocytopenia. So this is a blood clot in the venous sinus. It's the part of the brain that collects the blood in the veins and send so that that blood can go back into the heart. It's a fairly rare problem, but the incidence, its natural prevalence is 15 per million. Okay, we saw the issue with surveillance and epidemiology is it was in women so there's a cohort, and it was women who had the vaccine within 3 weeks prior. So that was a pattern, and so in being super cautious, the CDC basically put a pause on the rollout of the Janssen vaccine and said, let's look at this. And so first off, we had to teach the urgent care doctors and the primary care doctors about CVT-ST and teach them how to recognize it. So that was the reason for the pause. Is the doctors had to be able to recognize and order the CAT scan with perfusion studies that could actually diagnose this. So in that pause, there were 8 more cases developed in a total of 10 million people vaccinated. So it was 15 total. And then basically the scientific committee of the CDC had to look at this. And so they looked at the incidence. There were 15 and 10 million. The natural incidence is 15 in a million, which is actually more frequent than the 10 million. But they were in a smaller cohort of women that were aged 18 to 50. There was one woman aged 62, but no one else above 50, and no men. So we got a clear-cut safety profile from this, and at that point they gave the okay for us to continue to use the Janssen vaccine. So people have had blood clots, women who are especially on birth control pills or other estrogen hormones, we're probably advising them to do the other vaccine. But other than those, we're basically saying it's completely okay for everyone else to get the Janssen vaccine. And it's every bit as effective as the Moderna and the Pfizer, 100% effective in terms of preventing death and severe hospitalizations. So these vaccines, and we're really, really seeing now the efficacy come through. You're seeing that downward slope, and we're down in that low plateau of very low incidence rates now. We're only seeing 2 patients per 100,000 in San Bernardino County right now, and our positivity rates out of all the tests that we do for COVID, we're only seeing 1.2% positive. So we're really getting this under control, but it's not done yet. So we've opened up the vaccine in terms of safety coverage, and now we got data from especially Pfizer that that we've got the excellent safety data from the older adults now apply all the way down to children 12 and older. So we've now opened up the vaccine, and hopefully all the students on this Zoom call, basically you're all now eligible, and hopefully we're going to get everyone vaccinated. So it's moving forward, but the thing about why we have to continue is we hit the oldest people first. When we first vaccinated, we did the healthcare workers, and we did the people over 75 and then 65, and then the people over 50 with significant other diseases that made them weak. What's happened is we've got herd immunity in the older population now. So people over age of 65 were above 70% in terms of the percentage vaccinations. So where is the reservoir for the virus? Where's the virus living? Where is it growing? It's in the younger people now. And so we're seeing the incidence of COVID in younger people significantly in terms of percentage go up. Even though we're seeing low incidence, when we look at the actual people who are getting COVID now, it's our younger people. So that's why we have to continue. So there's an urgency there. The other urgency is, as long as this virus replicates, as long as it continues to grow, it can develop errors in its replication. And those errors we call variants. And those variants are continuing to appear. The other thing is, we're opening up society, right? On June 15th, all the orange tier, the purple, the red, the orange, the yellow, all of those guidelines are going to be released. So on June 15th, we have to get as many people who are vulnerable to be vaccinated. And right now, it's the younger people that actually are the biggest reservoir. And as long as it continues to replicate, there's the potential for variants. I want to talk a little bit about the vaccinations a little bit more. We're also trying to vaccinate a particular emphasis on our communities of color. This is a busy slide, and Beth has already told me too busy, but I wanted to show you. This is actually when you go onto our website, this is what you'll see, and you'll be able to track this on your own. And that's why I wanted to show you. This is actually a screenshot of the vaccination site. The upper right-hand corner is what I wanted to actually. Sorry, don't mean to give you a nice diagnosis. Let's go in the upper left-hand corner. This just emphasizes what I just talked about in terms of the age and the percentage of patients who are vaccinated. You see, 80 plus, we still have a little ways, but we're at 65%. But 75 to 80, from here on, we're really at herd immunity with the older population above 60. Now I want you to go to the upper right-hand corner and see what we're doing. We're really looking at communities of color, hugely important. The communities of color, number one, like other what we call social determinants of health, have the highest incidence of not only heart disease, stroke, hypertension, heart attacks, but COVID. So the Latinx population, the African American population, the Indigenous American population, all have significantly 3 to 3.5 times the incidence of COVID. Number one, they catch COVID much easier, 3 times more, and they die from COVID. The mortality rate is 3 to 4 times higher. So we're And this goes along with socioeconomic background as well. So we really are focusing on getting these percentages higher. This is the Hispanic or Latino. This is the non-Hispanic white, the non-Hispanic African American, the non-Hispanic Asian, and this is the American Indian, and this is the Pacific Islander. So a big part of it, and this is the vaccination. So you can see what San Bernardino County is approximately 56% Latinx. So that's why you see such a big bar, lateral bar here. Is we definitely have to get and target all of these populations. This is just another busy slide, but this is, if you go onto our website, you'll see we've actually color-coded all of our zip codes. And there is a public health determination of, it's called a Healthy Places Index, and it's a cumulative of 18 different indicators of behavior, of population health, and it looks at incidence of heart attacks. It looks at the economic levels. It looks at availability of food and food insecurity and travel, et cetera. And it divides areas into 4 quartiles. Quartile 1, this is the dark red, is the lowest socioeconomic quartile. And you can see the areas of San Bernardino County that we are targeting because these are the areas, quartile 1, that have the highest incidence of COVID, the highest mortality from COVID, and actually have the least access to medical care as well. So I put this slide up knowing it's busy, but I wanted to show you how we're tracking and really aiming to even out this process, because we need to get everybody, especially the most susceptible of the COVID. So a little brief thing on variants. You'll read in the newspapers about variants of interest and of concern and of high consequence. Interest is that we're just watching these variants, and they don't seem to make much of a difference in affecting the patients. Variants of concern is when we actually get evidence that there's increased transmissibility or increased disease severity. So you'll see all of these variants, and I'm going to go through just briefly. I don't want to clutter your minds too much, but all of the variants that you've heard about, the British, the South African, the Brazilian, et cetera, are of concern. We don't yet have any of high consequence where there's clear evidence that prevention measures or vaccines have reduced effectiveness or significantly reduced effectiveness. So just keep that in mind, variants of concern and of high consequence. These are all variants of concern, and you've all heard about these. The British variant, when I started this, in California, the incidence was 1.7% of the British variant. The South African, you don't have to worry about this unless you're a virology student. And then there's the Brazilian, and then these two, the 1427 and 29, are they really grew in Northern California, and they've spread down to Southern California. And you've heard about this double mutant, which is in India now. This is the Indian. So this is how many we have now in California. And this is as of May 5th. It's old. This is the British, almost 5,000. The South African, 67. And these are you remember those Bay Area ones. This is the Brazilian. Okay. This is the dramatic slide. This is almost mind-boggling. As of November 20th, right before our peak, we had 0 British. These are the Bay Areas, 8 and 3%. This is the South African, 0. These two are the Brazilians, 0. Look at the difference now. April 21st, 49% of our COVID viruses in our community in California are now British. And actually, I was just at a conference yesterday, Zoom conference, and it's up to 62% of our COVID virus in California is now the British variant. This goes to show you, it scares me. And if you're thinking of not getting the vaccine, look at this and see how the variants have been appearing. So, you can see that basically this is the reason why we're still feeling an urgency. We need to get everyone vaccinated as much as possible. So what I'm going to do now, I don't know whether there are any Q&A questions now, but I can open up for those, but I also have some myths that we can go through as well. And Beth, I'll leave it up to you. Do you want to? Should we go through the myths, or are there any questions right now?
Yeah, I think it's probably, sorry, this is Dr. Olivares. Yeah, I do think it's probably a good idea to go through the myths if you like, and then we do definitely have some questions. So I think just making sure that we give some time for that as well.
Great. We'll go through the myths first. I've been addressing the myths, because I answer these questions frequently anyway. So as I talk to you, I've addressed some of those myths. So this first myth is it's not safe, the vaccine. It was rapidly developed and tested. So the fact is the three critical stages, stage 1, 2, and 3 of the vaccine development were completely intact, and there were no corners cut. What was cut was all of the red tape, and actually everything was done simultaneously. So as soon as they started phase 1 testing, which is up to 100 people, and then phase 2, which is a few hundred people, less than 1,000, and stage 3 is 50,000, 40 to 50,000. They were starting production right away. So that all the steps that were cut were really the red tape, basically. So all the critical steps for ensuring safety were actually ensured and performed and verified. So very safe. Rapidly developed, yes, because we never had that much red tape that was cut. And actually, this messenger RNA technique is not rapid. What I didn't mention, we've been doing messenger RNA vaccines for over 15 years now. So another myth: I've had the COVID-19, I've recovered, so I don't need to get the vaccine. We see this a lot. We see this on healthcare workers too. The basic fact is that there's not enough information that's currently available. Basically, that if you've had it previously, that you're completely protected. What we've seen is that there's a significant inconsistency of people who've had COVID in terms of their immunity. So it's a very inconsistent immunity. So what's recommended is, even though you've had it, and it's pretty sure that you've had it, you need to get the vaccine. And one of the reasons is these variants are slightly more resistant to the vaccine and to your immunity, but the vaccine produces such a robust production of antibodies and T cells that it makes more than makes up for the slight increase in resistance. So yes, even though you've had it, we still recommend that you get the vaccine. Severe side effects of the vaccines. You've all heard it, and it's funny. I had to deal with this with my wife, who she Googled every single side effect of the vaccine before we went to get it. And I said, these are people that just want to get attention. I was completely laid out in bed for a day and a half. And so it's true. Some people can get a pretty bad flu reaction, fever, achiness, headache. But I don't know about you guys, but if I know something's going to end, I can tolerate almost anything, right? And these, even the most severe of these kind of flu-like illnesses, it's just basically are like a bad flu, but they go away after 2 days. So keep in mind, these basically the symptoms are actually your immune system kicking in. So your body's responding to it, and it's actually kind of a sweet pain in a way, because it's a sign that you're becoming immune, and then you won't have to face all of the issues of COVID. So another myth: I won't need to wear a mask after I get vaccinated. This may become reality. The CDC is, you guys are probably aware of that. They're saying if you're vaccinated, you can go outside and maybe even inside. Now the state is not allowing the inside yet in congregate settings, but more and more, it's been shown that if you're vaccinated, you're really safe. And more and more, you're going to find that you're not going to be able to go to a basketball game or to a movie or other events, et cetera, if you're not vaccinated. And we're dealing with that issue now in terms of enforced vaccinations. And I'll let the administrators and talk about that later if you'd like. So more people, myth number 5, more people will die as a result of the negative side effects of the vaccine than would actually die from the virus. I think you've seen by that graph how patently untrue this is. The percent mortality from the vaccines, you remember we've now seen 1.4 billion people vaccinated. The mortality is 0.0006 from COVID from this, and the vaccine, the mortality from the vaccine is you probably develop about 8 or 9 zeros to the right of the decimal point. Hopefully, I've been able to show to you how safe this vaccine is. So I talked about this. COVID vaccines will alter my DNA. And those of you who've taken molecular biology and genetics basically know too, it's impossible. It's a messenger RNA vaccine or it's an adenovirus. It does not affect your DNA. It's destroyed within 2 days. So they're all broken down. They don't last in your system more than 2-3 days. So it does not affect your DNA. Clearly, again, with our track record of track history of safety, definitely does not cause infertility, definitely does not cause miscarriages. We've had a lot of very valiant women in the healthcare field who were pregnant when they got their vaccine, when we were, because they saw the ravages of COVID and they said, I'm taking it. And they've actually done studies now on pregnant women, and there's the incidence of miscarriage is no higher than the general population. So it's very safe with your pregnancies as well. Another myth: I'm allergic to eggs, so I shouldn't get the vaccine. Well, neither the Pfizer or the Moderna contain egg or eggs. Okay, so there are allergic reactions. We talked about the allergic reactions, very rare. And so if you've had severe allergic reactions in the past, let the people know. And when you're getting the vaccine, we'll watch you a little for longer and just to make sure. But it's, again, very, very safe. So the myth, the vaccines must be stored at extremely low temperatures because of preservatives in the vaccine. Well, it's really the Pfizer that has the ultra low temperature. And actually, we just got a release from Pfizer today that now from at 0 degrees, it can be stored up to a month. So they don't contain preservatives, and they are okay if you're vegan and gluten free as well. So definitely nothing to be allergic to. So how do you sign up? myturn.ca.gov is the universal sign up. You now can call and basically, if you're a student or faculty, Cal State has a website, and I've listed it here, csusb.edu/COVID-19 with a dash between the COVID and 19. The Beth and Dr. Marchino and Lanice have been really amazing working with us in developing the capacity to test and vaccinate on campus. So we want to make it as easy for you as possible. And there are a lot of other sites in the county and even CVS, Walgreens, and Rite Aids too, where you just don't even need an appointment anymore. So If you want to make sure, go through the Cal State website, though. Okay. And any questions about the vaccine, you can go through here too. Okay, I've listed some resources if in case people would like a copy of this PowerPoint that basically explain all the. It's just the scientific background for all of that. So I'm going to stop share here and open it up for Q&A. But hopefully, I've been able to show that it's been an amazing ride. We've all lived through this pandemic. We're getting it under control. We've got it's a horrible disease, and it has really paralyzed every element of our society. It's been a universal effort. We've got it under control, and we have just a little bit more to finish this virus off, and it's to get us all vaccinated. So thank you very much, and I'd love to have any questions.
Thank you. Thank you so much, Dr. Cicada, for all the wonderful information. So we do have a handful of questions. One question I just want to address right off the top, because there's at least 3 or 4 folks that have asked the question regarding the university's vaccination policy. So we are currently still developing our vaccination policy, and that includes any possible grounds for exemption. So that was the question that a few folks asked about medical or religious exemptions. So just know that information will be coming. Keep an eye on your email for more information about the university's vaccination policy. So for folks that had those questions, just wanted to kind of respond to those off the top. The rest of these are much more medical and scientific related. So I'll leave those to the experts to respond to. So let me go ahead and get into those, and we'll try to respond to as many as we can while we've got some time left here. So the first question is, and some of these are questions you have kind of responded to already, but if you want to add anything, but this one I think is a little bit different than perhaps some of the questions that have been asked or that you had already provided information on. If we are currently a bit sick or have a cough and an itchy throat, do you recommend to take the vaccine, or should we wait until we feel better?
Yeah, that's actually it's a good question, because with the a lot of the other vaccines that like the influenza vaccine, if you've got a cold, we ask you to wait. We've actually done as long as you don't have active COVID from your cough and fever, it's okay to go and get vaccinated. It shouldn't affect your immune system, and incidentally, our influenza surveillance has shown our flu season this year is the lowest in the last 20 years. And so guess what made a difference? The masks and the distancing. So it really goes to show you, if we're really careful with influenza, we were really afraid that we'd have, we called it the twindemic, that influenza and COVID at the same time. And wow, we would have been in trouble if it hit us. But so yes, in answer to that question, unless you're really, really sick, of course, then take care of yourself and get better, and then get the vaccine.
Great, thank you. So you kind of hit on this already, but I don't know if you want to add anything. Just the question is about the number of cases of death after vaccination, but I think you gave kind of that breakdown of what that looks like, and it seems like again, you gave that statistic, I think, right up at the end in terms of what that's looking like. So I don't know if you want to add anything to that.
Yeah, is this the cases after vaccination?
Yes, cases of death after vaccination, correct.
Yeah. The incidence of true COVID after vaccination is close to 0 in terms of mortality. It's amazing how effective this vaccine is. There are breakthrough infections, though, so nothing's perfect, and especially when you're dealing with the heterogeneity of immune systems. People are variable immune systems and responses to the vaccine. So it's just such a small price to pay, for that security of basically not being susceptible to dying from this.
Thank you. Another question you kind of hit on, but this is maybe a little bit of a different twist on it. In terms of the long-term effects of the vaccines, how how can we know until more years pass? So since these are sort of newer vaccines, right? At least for COVID, how can we kind of build confidence in folks about these vaccinations when they're sort of on the newer end?
Yeah, and actually, I'm not none of us in public health or in virology and infectious disease are fortune tellers, so it's difficult to tell. But the way you can possibly foresee it is, those questions on, does it get into my DNA and does it affect fertility? So if you look at the science and how can a piece of messenger RNA that doesn't get incorporated into your DNA, that gets destroyed in 18 to 36 hours, how can that have a significant long-term side effect? It's difficult to predict, but it's really unlikely. So,
Thank you. What about folks who are allergic to the flu shot? I think that someone's saying it states in the vaccine paperwork not to get the vaccine if you've had adverse reactions to other vaccines.
yeah, if I could correct that, it doesn't say don't get the vaccine, but to be careful. One of the slides that Beth said it was too busy was I listed I listed all of the ingredients that are in the vaccine, and the only thing that might incite the immune system is polyethylene glycol. It's called PEG, and that it's such a low concentration. So even if you've been allergic to the flu vaccine, it's highly likely that you're safe with the COVID vaccine. So.
Great, thank you. Some of these other questions are ones you responded to, so I'm going to kind of pass over those ones. I can't recall now if you mentioned this or not. I know you obviously talked about the blood clots and the issues, I think, that were related to the Johnson & Johnson vaccine, but the question is, have there been any cases of blood clots associated with the Pfizer or Moderna vaccines?
Actually, no, not more than what we call its natural incidence in the population. So, and the other adenovirus vaccine, the AstraZeneca, also has the same kind of very rare blood clot disorder. Again, more in women. So, but the Pfizer Moderna, no.
Okay, thank you. So this is more of a comment, but I'll kind of rephrase it as a question, which is, if there's such a high recovery rate, I'm assuming they mean of COVID, why is there such an emphasis on getting the vaccine?
Okay, so good question, and I'm glad you asked that, because I hate to say it, but young people especially say, I'm just going to tough it out. I don't want to get that shot. So, okay, the first thing is, look at there is mortality. It's significantly higher than those in people who catch COVID than who don't catch COVID. The second thing is the pathophysiology of COVID. Young people, even though they have robust immune systems, can still get this cytokine storm, which leads to significant incidence of strokes and heart attacks, kidney disease, and the other thing is, if you catch COVID, not only is there a long haul syndrome where you can be sick for anywhere from 3 to 12 months, but I'm leaving this to go to another conference on the neuropsychiatric sequelae of COVID. Up to 30% of people who get mild to moderate COVID get significant depression and neuropsychiatric issues. So, all of these things, if you want to take the, brave the odds, I'd say one thing, but if you put that all on the other thing of you're helping the world and all of us basically eliminate this disease, on top of the fact that you'll then be able to go to Dodger games and movies and fly and Cal State, maybe. If you vaccinate, then there's such, talk about risks and benefits. To me, I tell you that the benefits are way outweigh the risks.
Thank you. So the next question, this is kind of more, I think, Dr. Skady, you may be able to respond to this, and there may be others here that can as well. The question is, what are the quarantine rules for international students coming into the state of California and San Bernardino County? The student asking is an international student coming from India. who will be starting with us in the fall of 2021.
Yeah, I think, yeah, I don't think they've changed recently, but it depends on if they're vaccinated or not. But in general, it'll be I think a test that will be required approximate to 72 hours and confirmed, and then there'll be a mandatory 10-day self-isolation. But I can get the exact, but I'm pretty sure it hasn't changed.
Great, thank you. Let's see. So this is kind of a more, I think, for the academic folks on the line here. The student is saying they're vaccinated, but they have a baby at home. And so they're wondering about in-person or remote learning options for classes. Does the student have a choice? And, yeah, basically, if the student is concerned about coming back, do they have a choice of doing remote or in-person classes, even if they're vaccinated, but they're concerned about being in a space where they're maybe putting themselves or their families at risk?
Hi, I'm happy to respond to that. I know that question is out there, and that issue is or need is being considered. However, because this involves faculty in the classrooms and the potential for faculty to be teaching online and being in the classroom simultaneously, there is a process of meeting and conferring with the faculty union and leadership to make sure that we can accommodate these requests. So there'll be more information coming, but to date, we don't have anything final.
Thank you. So I know we only have probably time for like one more question. This is a question I don't know if I know the answer to this or know what they're referring to, but the question is, are there vaccination package inserts available for the COVID vaccine? Is that something that sounds familiar to you, Dr. Sequeira?
Yes. The package inserts are produced by the pharmaceutical manufacturers, and they basically list every possible side effect you can get. And yes, and that's available on in the resources I gave you in the if you just go to Pfizer's website as well as our website and CDPH. It's available in all of those.
Information is there. Okay, great. So I know we are pretty much out of time for today. So thank you so much again for everyone joining us today. Thank you so much, Dr. Sequeira, for being with us. This session has been we will post this recording on our COVID-19 website for the university, so you can come back and revisit this information if you like. You'll see that last slide that has lots of information and Dr. Sequeira's information as well for his office if you'd like to ask any further questions. You can always, of course, reach out to us if you have any questions related to university policies and our return to campus and all of that good stuff. But thank you again to all of our university administration that joined us today. Much appreciated. And again, thank you for all of our participants and of course to Dr. Sequeira for all the wonderful information. Everyone, have a wonderful day. Stay safe and healthy. Get vaccinated.
Bye-bye.
Take care, everybody. Thank you.